Good day, everyone. I am Rex Heimelin, and I currently lead the sales and marketing team of PIC Philippines. It is my honor and privilege to introduce our next speaker, Dr. David Casey. Dr. Casey is currently the Director for Product Development for PIC Global, as well as the Asia Director for Product Performance. His major responsibilities include leading the technical services team across the many aspects of pig and pork production to support PIC's key accounts in Asia. Apart from his role, he is also an adjunct assistant professor at the North Carolina State University. David grew up in America, where he helped his father raise pigs and feeder cattle and also helped at the family slaughterhouse. His academic background includes a Bachelor of Science degree from Wilmington College of Ohio, which he received in 1992, an MS degree from the University of Nebraska in 1998, which eventually culminated in his PhD from Iowa State University in the year 2003. David has worked at PIC for the last 18 years and currently resides in Shanghai, People's Republic of China. Friends and partners in the industry, ladies and gentlemen, let us all welcome Dr. David Casey.
Thank you so much for inviting me to speak with you today. I apologize I can't be with you in person. I live in China, and as you guys know, moving in and out of China is not such a simple task lately. But hopefully next time I'll be able to meet with you in person. Today what I'm going to talk about are updates on PRRS-resistant pigs at PIC and at Genus. Many of you guys all know PIC. Our parent company is called Genus, and we're working to create a PRRS-resistant pig. PRRS-resistant pigs will make animals healthier and will also create a more sustainable food system. We all know farm animals get sick, and sometimes they get sick with diseases that have no cure or vaccine. And really, today what we're going to talk about is PRRS. PRRS is one of these diseases that causes great amount of sickness and death. There are vaccines, but they're not highly effective. So what's the fallout? The fallout to the animal with these kind of diseases, including PRRS, is death. Number two, to the animals that live, it's a lifetime of secondary infections and suffering. To the farmer, for the animals that die, it's a loss of the animals. To the animals that live, they don't grow as well. They're not as productive. So there's an economic loss to this. And that forces the farmer to use more antibiotics to treat those secondary infections. To the consumer, they don't like systems that cause or diseases that cause animals to suffer. They also want less antibiotics, and they want a safe food system. But all of that needs to make affordable meat for them. To the food companies, they're really concerned about sustainability impacts. They've made significant commitments to that, and they're looking for systems that can improve these efficiencies. They're also looking to eliminate waste, and they also want fewer antibiotics used. And to the environment, diseases like this create more waste, and that's not good for the environment. So we need systems that can bring greater benefits to the environment. So let's talk in more detail about PRRS. Many of you in the audience have been through a PRRS break before. And know, it has a big impact on the sows. It does cause an increase in sow mortality, but the biggest impact is really the loss of pregnancies, abortions, stillborn pigs. Okay, so about 12 to 15% of these pregnancies failed. The pigs that live, or to the baby pigs, a lot of animals will die. Those that live have a weakened immune system, so they're more susceptible to pneumonias and diarrheas, which require then antibiotics to treat those. And they don't grow as well for the rest of their lives, or they're not as productive. It is estimated that PRRS causes the U.S. pork industry about $664 million per year, and to the European pork industry about 1.5 billion euro impact. That's the US and EU. If we look at Asia and how big Asia is, the impact's going to be even greater. So PRRS has a significant impact to the global pig industry. So Genus's vision was to be able to create a PRRS-resistant pigs through genetics, really through gene editing. The vision was to be able to create a resistant pig that then lives a happy life. So a resistant pigs means no death, no secondary infections, no additional use of antibiotics needed as a result of those secondary infections. And that disease resistance in the animals would be created through gene editing. That's the vision. But first, let's talk about the technology to create that and why this is possible. You guys have heard in the news probably quite a bit about CRISPR-Cas9. Actually, it was invented or came to being and useful in 2012. And it's been an incredible 10 years. CRISPR-Cas9 is a gene editing tool that has been used in human health, plant agriculture, and animal agriculture. And it really led to the 2020 Nobel Prize for the inventors. And here's a book called Codebreaker that's really about their story. Now, CRISPR-Cas9 really was discovered. It's a system that's in nature. And what they were finding is bacteria that was being used in the making of yogurt. The bacteria had an adaptive immune system that would make it immune to certain viruses. And so Philip Horvath and his team at UNESCO were really researching and trying to understand it. And that's when they found this CRISPR-Cas9 complex that was allowing the bacteria to be immune to certain viruses. And what was happening was it was changing the DNA of the virus and then would make it immune, or the virus couldn't attack the virus. So that was published in 2007, and then applications of that started to be thought out, and that's where Jennifer Doudna and Emmanuel Charpentier started to use it and published on the use of this for gene editing for other species. Okay? So how does CRISPR-Cas9 work? Well, first, Cas9 is an enzyme, a protein that it used as an enzyme. You combine it with a guide RNA. So we can actually design the guide RNA. Those two molecules come together into a complex, CRISPR-Cas9, that then specifically binds to the DNA. Okay, so this is double-strand DNA here. The Cas9 sticks to the DNA. It will then unfold the DNA where the guide RNA can then bind to a very specific site on the DNA. And then at that point, the Cas9, the enzyme, does a double-strand cut through the DNA. Okay? Now, your DNA breaks all the time. And then you have mechanisms in your body to repair that break. Now, a lot of times that system is very efficient and does a good job, but sometimes in the repair, a mistake is made. A code is changed, and that's what we call mutation. And that's what we're doing here. We're using this CRISPR-Cas9 to create this cut, and then in the repair, a mutation would be created. So it's very targeted. You can go to a very specific site with a very specific guide RNA and do a very specific cut and a very specific change. That was the beauty of this technology. These kind of things happen in nature already, but now we're doing more guided cuts and repairs. On the left here is a picture very similar to the previous, but a little more condensed. And then basically showing, so you have the cuts, and then you have the repair, and a mutation is created. Okay. Now, here's some comments from some different officials to highlight that gene editing is not the same as genetic modification, or what we commonly call GMOs. So GMOs are bringing in DNA from a foreign species into the species that you're changing and basically randomly inserting it into the genome. Okay? But what I've described really is something already happens in nature, and it's a very specific site and a very specific change. There's no foreign DNA introduced. It's just making a change in the current DNA. So it's not the same as GMO. So now that we've talked about the technology, now let's talk about how to utilize that technology to make PRRS-resistant pigs. In this, Genus worked with third-party partners to develop the idea, to be able to do the basic research, and also to provide some oversight and testing. And we had two partners. One, the University of Missouri, so this would be Randy Prather's group, Dr. Randy Prather, and the Roslin Institute in Edinburgh, UK. So now let's talk a little more details about PRRS and get into some details about PRRS. PRRS is an enveloped single-strand positive sense RNA virus. Okay? It was first discovered in the 90s, and really there's two main variants, type 1 and type 2. It is prevalent in most pig-producing regions around the world. Very prevalent in the Philippines, definitely prevalent in China, and all through Asia. There are a few exceptions to that. Brazil is free of PRRS. Also, Australia would be free of PRRS. PRRS causes reproductive and respiratory impacts. Causes mortality, also morbidity. Vaccines do exist, but they're generally not so effective. It is harmful to animal health, but it has no impact on safety of meat. And there's no crossover to humans. There's no infection in humans. Okay? PRRS only affects very specific cells, enters the body through the lungs. And really, to enter the body, it requires a gene or a protein that is coded by a gene called CD163. Okay? And that's what we're going to be talking about is CD163. And that is the gene that we changed. Okay? But when these researchers started, they didn't know exactly how PRRS was entering into the body. Okay? So here in this schematic, the PRRS virus, they knew there was a heparin sulfate and CD169 protein on the surface of the cell wall in the lungs. So the first belief was that CD169 was the culprit. This was the receptor. So the gene editing first focused their efforts on CD169 and making changes. But after making changes and knocking this gene out so this protein didn't exist, the pigs were still susceptible to PRRS. So they realized, no, that's not exactly the receptor. Okay? So even without this protein, the virus could still enter into the body. Okay? In the process then here, we have endosomes created. So you get endocytosis happening here, where it's being brought into the cell. And then there's also an additional protein, CD163, and it was thought to have a role. So the researchers next started to make gene edits to CD163 and knock it out, so that to be able to see if that could confer resistance. And lo and behold, they were successful. When they were able to knock out this protein, or basically knock out the gene so there's no protein, the PRRS virus could no longer enter the body. And what we've learned since then is that this protein uncoats the protein, or uncoats the virus, and releases the single-strand RNA into the plasma. Okay, so it was needed for the PRRS virus to enter the cell. So what the University of Missouri had done is they put a gene edit here. So this is CD163. This would be the G, okay? And so you have exons 1 through 16. These are the coding, when I say exon, these are the coding regions of the DNA that then create the protein, okay? So they put in a gene edit, or basically put in a stop codon, so that when the protein's created, it stops transcribing here. So you'll get this part of the protein to here, and the rest of the protein no longer exists. So that's what the University of Missouri did there. Roslin Institute did something different. What they did is they did 2 cuts in the DNA, and they did it around exon 7 here. Okay, so they put a cut here and a cut here, and basically cut this section, exon 7, out, so that the protein existed all the way to here, but this part of the protein no longer existed, and then the rest of this also existed. Okay, both of these outcomes created PRRS-resistant pigs. So from this research, what we learned is really the binding site, or the region that was really important for causing the PRRS virus to enter the cell, was exon 7, or in the protein, it's domain 5. So both universities created these pigs, and then you need to do a disease challenge. Okay, so both of them would expose young pigs to specific strains of the PRRS virus, along with normal unedited pigs. The edited pigs showed no viremia, showed no clinical signs. Lung pathology was normal for 35 days afterwards. So for both researchers. For the normal wild-type pigs or unedited pigs, they got sick as normal. So in both of these cases, both research groups were successful at being able to create PRRS-resistant pigs. And they did it by editing CD163. So the University of Missouri first published their results in 2015. Both groups showed that this could be done, and since then has been further verified by multiple universities around the world. So now that the basic research was done, PIC then had to start thinking about how do we create this PRRS-resistant pig in PIC lines. And so that's what I'm going to talk about in this section. So first, PIC did the gene editing on donor embryos. So we would breed an elite female to an elite male, and on day 1 embryos, we would extract these from the donor females. So we would extract the embryos. Then what we would do is take those embryos, and they were normally in a two-cell stage, we would then use microinjection to inject the reagents, so the CRISPR-Cas9 molecules, to do the gene editing. Okay, we would then grow those for a few days, and then implant those into, or we would, through surgical transfer, we would put those embryos into a surrogate female. Okay, right about the time they should start implanting. And those pigs that were then born from that is what we call E0 piglets. So they would be born about 114 days later. Okay. Now here I show a variety of different colored pigs, because while CRISPR-Cas9 is one of the most efficient gene editing systems, it doesn't perfectly create exactly what you want each time. So really, the PIC genus approach was very similar to the Roslin Institute. We did 2 cuts, and ultimately to cut out domain 5 of the protein. So we're changing, remember it's exon 7 on the DNA. We're cutting out that exon 7 and ultimately removing the domain 5 of the protein, so that when the virus comes close to CD163, it will not bind, it will not be uncoated, and that single-stranded RNA cannot enter the cell. So thus the pig is completely resistant. So that's the approach that we did with our pigs, was similar to the Roslin Institute. So in doing this, what I'm going to demonstrate through a simple cartoon. These would be donor animals that we would then breed them. We would extract the embryos from those and do the gene editing. Okay. Now the pigs that were created from that. Some pigs would have the desired edit that we wanted, and some pigs didn't. And in many cases, the pigs that had the desired edit that we want wouldn't have both copies. Okay, so we had to do a lot of molecular characterization to really find out which pigs had the exact edit we wanted. And ultimately, in creating this, we wanted pigs to have the exact same edit, no differences. And we didn't want any pigs that had some off-target cuts. So yes, CRISPR-Cas9 is specific, but sometimes it can go to other places in the DNA. And so we were looking at those sites, and it doesn't happen very often, but when it did, we did not want those pigs. So we would remove those pigs. Okay. So here in the E0s, we're showing some pigs that would have the copy that we want, and a lot of pigs didn't. Well, some pigs just didn't have those copies. Okay, so we would select the animals that we wanted with a very specific edit. We would then cross those with what we called a wild type, or an unedited PIC pig. Okay, so in doing that, then we could have a really nice background that we could do good molecular characterization and ensure we had exactly what we wanted. So from that, we would select the offspring that only had the edit that we wanted with no off-target effects. Okay, so that's what we were selecting from that, so that every pig that came out of that would have the exact same copy, and the rest of things were unchanged. So then those were bred together. So these E1s, and they would be heterozygous animals. They would be bred together, and based on Mendelian sampling, you're going to get a fourth of them that are going to be homozygous for the edit, half of them going to be heterozygous, and a fourth of them are going to be homozygous, no edit at all. Okay, so it's the homozygous edited animals that we want. We would breed those together to make the E3s that would be 100% gene edited. These animals that are homozygous gene edited are the animals that are resistant. So this gene edit, you need 2 copies. If you only have 1 copy, the animal can still get sick. You need 2 copies for the animal to be resistant. So you've got to be homozygous. Now, the last cartoon was a simple cartoon. It was much more complicated. It took a big team of experts to be able to get this done. So first of all, to do the gene editing, you need an embryologist that knows how to work the micromanipulators and do the embryo injections. Okay, you need a team of geneticists that are picking out the elite genetics that you want to use as your donors. Okay, you need reproductive biologists and vets that can do the embryo transfer and the surgeries that are required to do that. All the molecular characterization that I talked about, that requires a team of bioinformatics and genome science people to generate the results and make sure that we were selecting exactly the animals we want. And then you've got the farm workers to take care of the pigs. And yes, we were successful in being able to create pigs with the gene edit. So here is a pig that is gene edited. It looks normal, doesn't it? It is. It only has a very small change in its DNA in the CD163. It is a normal pig. And this is what success looks like. Many of you guys know PIC products and would easily be able to recognize this is an 800 female, and this would be our large white or line 3 boar. Do they look normal? Yes. These are E0s, so these would have the gene edited. They're normal in all ways, except a small change in CD163. Now, there's a lot of misunderstanding about gene editing. And so I want to make clear here what it is and what it is not. So hopefully you understand my scientific explanations about how CRISPR-Cas9 works. But here, no additional DNA is inserted into the genome of the pig. Nothing is coming from outside or a foreign species and put into the pig. Really what we're doing is we're turning off genes, or in this case, we're just turning off a section of a gene. The rest of that protein is still functional. We're just removing a small part of that. Okay? So we're turning off genes to make it susceptible to the disease. Okay? The focus here is we're trying to make the animal healthier, and we're focused on eradicating the disease with no cure. What it's not, this is not transgenic. We're not introducing foreign DNA. What we're not doing is we're not using this for human amusement. This isn't designer animal production here. The changes we're making are there to make the pig healthier and to create a more sustainable system. What is not is used to allow animals to withstand harsh conditions or allow for abuse. That is one of the concerns of consumers. So, what is the path to commercialization for these PRRS-resistant pigs? One note I forgot to mention earlier. All of that work I talked about earlier is being done in America, and it is all being done under regulatory body FDA, Food and Drug Administration. So all of it is being done under their careful watch and guidance. Gene editing, as I showed in earlier slides, CRISPR-Cas9 was first published in 2012. It's only been 10 years. So it's a relatively new technology. There are several examples in fish and other livestock, but it's still in the very early phases. Okay, so this technology has got to go through regulatory approval before it can be utilized and commercialized. Okay. We are at PIC and at Genus, we are committed to doing this right. We will be transparent and proactive across the global landscape. We need to make sure that markets that export pork, that we must also consider the approval in the export markets. And we believe this technology and what we're doing with the PRRS resistance is setting the stage for delivery of future innovation as well. So if we look at regulatory approval, there are two types that we must consider. One, for countries that are importing meat, okay? In order to import meat from gene-edited animals, they're going to have a regulatory approval. Okay, so for example, Philippines produces most of its meat, but it is importing some. And in order to export meat that comes from gene-edited animals, we'll have to go through a regulatory approval in the Philippines. And that's going to be true of any importing country. Number two regulatory approval that's needed is if you're going to produce the gene-edited pig in a country and use it in production, you'll have to go through a regulatory approval there too. So let's look at global regulation across the world. What I'm listing here on the left, these are countries where we have known regulation, and those regulation are what we would call low risk or more simple regulatory processes. To the right are countries that either don't have a regulatory policy yet or have unfavorable policy towards gene editing. Okay, so let's get into some specifics. Brazil and Japan and countries like Colombia and Argentina, their approach to gene editing would be similar to those officials that I commented before. They want to evaluate if the change in the DNA you made was a GMO. Did you introduce foreign DNA? If the answer is no, if through that evaluation the answer is no, then you can utilize that product in their country. So their regulation is just determine if it's GMO, and if not, then you can commercialize and utilize. Okay, so these are known and low risk and more simple process to get approved. And these are, and if you look at these countries, these are priorities. Okay, Japan is a major importer of pork, so from many parts of the world. So we're going to have to get, it's a priority for us to get approval there. Okay, U.S. is our top priority. The U.S. and Canada have a risk-based approach. It is regulated by FDA. And so they'll evaluate the risk of each gene edit or genetic modification, and they'll determine a pathway very specific to that risk profile. Okay. Canada and U.S. are pretty aligned. England does not have regulatory process yet. They're currently developing that. It's showing signs of being favorable. And then you move to the EU. They're going to treat gene editing like GMOs. So to get it approved, it's going to have to go through a GMO process. Mexico is going to be, they don't have regulation yet, but tending towards GMO. And at this point, China, it will regulate this like GMO. But earlier this year, they created a more streamlined approach for gene-edited plants. And will be developing a different regulatory pathway for gene-edited animals, but they're still developing that now. So let's talk a bit more about the FDA, okay? So, and the work we're doing in the U.S. Remember I said that this experimentation or putting the gene edit in PIC lines is being done in America. So we're working under FDA's approval and research guidelines and rules, okay? So everything we're doing and everything I describe, these animals are not entering the food chain. So we're being very careful about that, okay? We are working with FDA. We're also working with anywhere we're going to export from America. So including Canada, Mexico, Japan, China, South Korea, and including the Philippines. So the FDA has a 7-step process. Really, the first one is you have to define your product. What's your claim? Animals will be resistant to PRRS. Okay, step 2 is you have to define what's the change that you made in the DNA. How did you do it? How are you verifying it? Step 3, then how are you putting that in your pigs? What is your molecular characterization of your specific animals? How did you evaluate their DNA, RNA, protein? Then the rest of these steps are evaluating the animal. So step 4 is, okay, is the pig normal? Compare it to an unedited pig. Are there any differences in, let's say, growth rate or reproductive traits or livability or robustness? So here's where the comparison will be done. The idea is you don't want unintended consequences to the pigs. You want the pig to be healthier. So that this is an evaluation of that. Is the edit durable? Meaning, will it be passed from generation to generation? So you have to prove that. Also phenotypically. So will the pig be resistant to PRRS each generation? You also have to evaluate its food safety. So you'll compare pork from gene-edited animals and pork from normal or unedited animals to see if there's any difference. So you'll look at meat quality, but also you'll look at composition of that meat. And then ultimately the last is a summary, effectiveness and claim validation. So that's their 7-step process. We're well into that process. A lot of those experiments are ongoing. So today, as I described, we have E2s. So remember, the E2s were a 4th homozygous edit, half heterozygous, and whatnot. So we do have resistant pigs on the ground. We've done this in 4 of our lines, line 2, line 3, or 337 and 800 populations. So now that we can have resistant pigs, we are going through a lot of these experiments today. So we've had several submissions to FDA. We have a submission that can happen this fall, and the rest of these packages will be submitted sometime in 2023, maybe 2024. So we're well into this process with FDA and doing these experiments. So now let's talk about consumer perceptions. And really, over the last 10 years, the media is telling a good story about CRISPR. They're telling a story that CRISPR is faster, cheaper, more accurate, which is true. And there are applications in human medicine, and crop ag, and also livestock ag. Here's some headlines. And you've been seeing more and more headlines over time that are making mainline press news about the benefits of CRISPR-Cas9. So back in 2018, we did a consumer survey, okay? And we repeated that in 2021, okay? We wanted to understand what were the consumers' concerns, what were their attitudes towards gene editing. What we've seen is consumers' awareness of gene editing increased by 66%. So currently 30% of the people are aware of gene editing. Their comfort with gene editing also increased. So 45% are comfortable, 80% are neutral or comfortable, okay? So there's been improvements and increase in momentum on information related to health and safety. Positive news have really helped it. So a number of the applications have benefited. The human medicine has created a real positive halo around this. But consumers do have concerns, and they want that to be taken seriously. They are serious. They want transparency. They want to know what's in their food. They also want assurances that there are no unintended consequences. They want commitments to safety and testing, and they want us to do what's right for the animals. So, we take those concerns very seriously at PIC and at Genus. Everything we're doing is part of the regulatory process. So we are committed to doing this right and doing it transparently. So we will follow all regulatory rules of each of the countries. Okay? We want to make sure that no animals entering the food system introduces any new human allergens or cause any human risk. So we're doing the experiments to evaluate that, to make sure that we're being safe for the humans. Okay? We want to make sure that the meat from any of these animals entering the food system is nutritionally equivalent. or more nutritious than meat from other farm animals. So we're evaluating that today. And we will comply with all the FDA testing and safety requirements, along with all other regulatory bodies in markets around the world. And at Genus, we're also constantly evaluating for unintended consequences. We designed this to be beneficial to the pig, but we need to evaluate if the changes we made have unintended consequences elsewhere. And so we're evaluating that, and we'll constantly evaluate that. So Genus is we've put together our ethical commitments to this. Our commitments to this is transparency, that human health comes first, that we will not introduce allergens. If it does, we stop. We won't keep going, okay? We will comply with regulatory bodies, and we'll do it openly. We will make the pigs healthier. That's the intent of all this, so this is our commitment. We will make sure that we monitor for unintended consequences. And we want to make sure that we do this that benefits the environment. And we'll make sure there's third-party oversight. Also at PIC and Genus, we work with a coalition of industry partners that have come together to really design a framework to be responsible with gene editing in agriculture. Okay, so designing a framework of how we would research or potentially commercialize gene editing, and to do it well and to do it right in a way that's good for the consumer and protects the consumer. So here you can see some big groups and companies that are involved in that. So in conclusion today, you guys have quite a bit of experience with PRRS. We know it's devastating. It's devastating to the pigs. It's devastating to the farmers. It's not good for extra antibiotic uses, as consumers would not like PRRS and its impact. They want the animals to be healthier. We have an opportunity to eliminate this disease, and we do it through gene editing. That doesn't mean we're inserting foreign DNA. Remember, we're just cutting out exon 7 of CD163. So we're just cutting out a small piece of that protein so that the PRRS virus can't enter the cell anymore. This confers resistance. It makes the animal healthier. It reduces secondary infections, so it reduces antibiotics. It makes our food system more sustainable, more efficient. These are the things that consumer wants. They want a better system, fewer antibiotics. They want a healthier pig. Genus is working to commercialize the PRRS-resistant pigs. It appears we could do that in 5 years, but we will do it ethically and responsibly. We will follow the regulatory bodies. We are evaluating for unintended consequences, and we're doing those evaluations as we speak. We will be transparent and focused on doing what is right for producers, for the consumers, and most importantly, to do what's right for the animals. Thank you for your time today. Hopefully this was educational, and I hope you guys have a great conference for the rest of the time. Take care.
At PIC, we never stop improving. We focus on the latest innovations to drive genetic improvement. As a global company, our people have been united for over 50 years with a passion for producing nutritious, high-quality pork and a commitment to continuous improvement. In doing this, our goal is to nourish the world. In the early 1960s, we were founded with a simple goal: to provide pork producers with a high-quality pig that costs less to produce while increasing the supply of safe and affordable animal protein. Faced with a growing global population, but with fewer natural resources to call on, our founders realized that farmers need to produce more with less. The work that they started with animal genetic improvement still applies today. Established in more than 18 countries in over 6 continents, we have created thousands of opportunities for growth for nearly 50 years. Our strength lies in our people. Therefore, we are committed to developing a globally diverse workforce by fostering a culture of communication, transparency, and innovation. Understanding our global responsibility, we are continuing to contribute to the communities we serve, focusing on sustainability and lowering our carbon footprint. Together, we are building a world-leading porcine business that enables our customers to succeed. We are leading the industry with innovative technology with our PRRS resistance program, positioning ourselves as a people magnet, and digitally enabling our organization to successfully navigate through a time of transformational change. Our employees are the DNA of PIC. You play a part in the success and future of our business. Whether you work at a farm, in our offices, or somewhere in between, your contribution is a significant part of our mission to nourish the world. At PIC, we never stop improving.